Did you know that for the most part, Medicare does not cover long-term care? That's what we're going to talk about in today's video, so please stay tuned to the end. My name is Jamie Pripp. I'm an independent licensed agent helping people understand the Medicare program and find the coverage that fits their needs. One of the questions that many Medicare members have is about long-term care, and many don't realize that Medicare does not cover long-term care, and so that's what we're going to talk about in this video. So I'm over here on the Medicare website looking at the page on long-term care. So just medicare.gov. As you can see here, it says Medicare does not cover long-term care, also called custodial care, if that's the only care you need. Most nursing homes are considered custodial care, and so custodial care, they give a little definition here. Non-skilled personal care, like help with activities of daily living like bathing, dressing, eating, getting in or out of bed or chair, moving around and using the bathroom. It may also include the kind of health-related care that most people do themselves, like using eye drops. In most cases, Medicare does not cover or pay for custodial care. And so there's a clear definition here that you pay 100% for non-covered services, including most long-term care. And so let's just look at what they talk about here on this page about skilled nursing facility care. And so it says, in certain conditions, for a limited time on a short-term basis, if all of these conditions are met, meaning you have Part A and have days left in your benefit period to use, you have a qualifying hospital stay, your doctor has decided that you need daily skilled care, it must be given or under the supervision of skilled nursing or therapy staff. You get these skilled services in a skilled nursing facility that's certified by Medicare. You need these skilled services for a medical condition that either is a hospital-related medical condition treated during your qualifying 3-day inpatient hospital stay, even if it wasn't the reason that you were admitted to the hospital, or a condition that started while you were getting care in the skilled nursing facility for a hospital-related medical condition. For example, if you develop an infection that requires 4 antibiotics while you're getting skilled nursing care, and then it gives you your costs in original Medicare, and it breaks that down for you. So the important thing to remember here is that, again, when it comes to long-term care or custodial care, for the most part, Medicare is not going to cover that. And so in this article that I want to show you here, put out by Dave Ramsey, just talks about the need for long-term care insurance. And so he goes through a scenario here where he talks about a couple that had saved up and built a nest egg of $300,000. When Steve was 67 years old, he developed Alzheimer's disease. At first it wasn't too bad. Rachel used some of their nest egg to hire a home care specialist to help with Steve a few hours every day. But as his condition worsened, Steve had to go into nursing care. Sadly, after 5 years in the home, Steve passed away. Rachel, now 72, is healthy as can be for her age, but she has to work full time because her husband's stay in the nursing home cracked and scrambled most of their nest egg. So unfortunately, what he goes on to say is that their story isn't unique. Around 63% of caregivers say they paid out of pocket for long-term care with their own savings and retirement funds. But you can keep that from happening to you by having a plan, and that's called long-term care insurance. And so he goes in and he begins to explain that long-term care insurance is basically nursing home or assisted living insurance. It pays for the long-term care services like getting dressed or taking a bath that some folks will need help with as they age or become ill. And then as long-term care can get expensive, really expensive, According to the Alzheimer's Association, the estimated cost for care in the final 5 years of life is $367,000 for people with dementia and $233,000 for those without. But on average, Americans spend $140,000 out of pocket on long-term care. That's out of pocket. And so it's important to remember that most health and disability insurances won't cover long-term care, but long-term care insurance will. And so as you can see here, it gives you a little breakdown of what long-term care insurance can cover. Nursing home care, assisted living facilities, adult daycare services, in-home care, home modification, care coordination. Then it just gives you an explanation of why you need long-term care insurance, which probably at this point in the video is pretty self-explanatory. It does give you a little bit of a breakdown here of the cost of long-term care insurance. What I'll tell you is that each person's situation is unique. So if you would like a free quote on long-term care insurance here at Insurer Rates, we'd be happy to help. You can request a quote on our website, and I'll leave the link in the description. Or you can give us a call at the toll-free number in the description as well, which is 800-974-0552. Again, my name is Jamie, and if you have other questions about Medicare, feel free to leave them in the comments below, and I'll try and answer them to the best of my ability. If you like videos like this, please consider subscribing and sharing it with a friend. Thank you so much for watching. Have a great day.